Welcome to the Making a Man podcast with Scott Myslinski, the show where we go deep on all topics of masculinity, manhood, and becoming a better man. This includes relationships, self-identity, entrepreneurship, philosophy, hormones, and more. I'll be speaking with a variety of experts across topics and learning along with you on this journey to make a man. Dr. Michael Whitmer has been in the practice of hormonal optimization since 1980 after receiving his DC degree from Logan University in St. Louis, Missouri. He's the clinical director of the National Rejuvenation Center in St. Louis. Dr. Whitmer has also been a faculty member at Logan University since 1984 until present day, along with serving as chief of staff from 2010 to 2015, educating thousands of physicians around the country. He is also a certified USA weightlifting coach and served as a valued member of the USA Weightlifting Board of Directors. Since starting his practice, Dr. Whitmer has helped thousands of patients and is committed to the best possible care for them. Jeff, Dr. Whitmer's son, is a former Olympic weightlifter who began at the age of 10 in his home basement gym. After a few months of training, Jeff decided to enter his first meet, and from there, he had continued success by winning his first 50 competitions and accepted an invite to the Olympic Training Center in Colorado Springs to compete for the U.S. Jeff is also part of the team at the National Rejuvenation Center in St. Louis with his father. Welcome to the show.
Thank you.
Yeah. So would love to hear a little bit, you both have a background in powerlifting. Can you talk about the evolution, especially, I'll ask Dr. Whitmer to go first. How did that evolve from powerlifting to anabolics use and then eventually finding TRT?
Weightlifting, not powerlifting.
Weightlifting.
Yeah. Weightlifting is the Olympic lifts, the snatch, the clean.
Got it. Right. Not
powerlifting's
bench squat and deadlift.
Yeah, a little different sport. Well, back in my day in the 70s and the 80s, once you got to a certain level, the only people beating you were using anabolic steroids. And if you wanted to continue to improve and compete at that level, that was just a natural process. It wasn't a big deal. There was no rules against it or anything like that. It was just part of it. We looked at it just like putting chalk on your hands before you did a lift and drinking a protein shake after a workout. So it was no big deal. That's really how I got into it. And then as far as the TRT, it just got old. After I stopped competing, of course, I stopped using anything. And then over the years, just got older. And, my wife, Jeff's mom, went through menopause and all the bad things that women deal with when that happens to them. And we just kind of started looking at ourselves going, we're not going to give into this old age stuff. So here we are. I've been on testosterone now for, I think, almost about 9 years. And it's great. Obviously you kind of get your youth back. My motto is that no frail old men. Yeah, that's not going to be me. I'm not lifting nearly what I used to, but I'm going to hang on to the bitter end and do the best I can with what I've got to work with. And it's lifestyle choice, really, the way I see it. Looking back, I wish I had done it sooner, really.
And how about you, Jeff? How did that kind of natural evolution happen for you?
Yeah, as far as weightlifting goes, I started kind of doing the Olympic lifts at 10. And then kind of even before that, I would go to the gym with my dad when I was like 7, kind of was doing squats with a broomstick in the corner, push-ups, sit-ups. So part of I was raised from a young age, hey, like this is something you do, exercise is a part of life. So it was kind of ingrained in me from a young age. And, looking back, I'm grateful for that. We'll do the same with my kids. But from 10, you kind of nailed it with the intro as far as, my evolution in the sport goes. I competed on, some national teams, junior world teams, competed in 2 of the Olympic trials, came pretty close in 2008. And then, after that, I got out of competing when I was about 24, 25, realized I didn't have my, college degree yet and had put some stuff on hold. And I said, it's time to start making some money. And weightlifting is not the most lucrative sport, unfortunately. More opportunities now in kind of this day and age. But, I had worked kind of multiple jobs. I'm almost 37 now. But as far as getting into the hormone optimization therapy, I came up in weightlifting to where, it's a drug tested sport. All the information that's being pushed out there was, obviously it's cheating. We can all agree on that, and it's against the rules. But a lot of the things that were getting pushed out about, is basically anything on the ban list from USADA, WADA was harmful for your health. When if you actually look at the ban list, there's a lot of things that used properly, are beneficial for your health. So there was a negative connotation anytime you would hear any of these, even the compounds we prescribe today. It was just, hey, that's poison. And where I was, what opened my eyes was, someone, you're friends with Chris Bell when he came out with Bigger, Stronger, Faster, and kind of think he broke some of those connotations where, hey, like if it's used properly, it isn't bad. And that's kind of what opened my eyes to it more. That was kind of the start of a mindset shift to me where I'm like, hey, there could be some good in this. And I had always followed some of the research, and I saw, more clinics were kind of opening up over the years. I mean, granted, I don't feel like this has been a long I think the last decade or so, it started to pick up more. But seeing the benefit that my dad had from it, where I'm like, hey, he's working out more than me now. And I was, in my, after I turned 30, he was looking, almost better than he had, the years prior. And I'm like, hey, then I got to a point when I was 32, I was feeling really tired myself and had low sex drive. And, my body took a beating from 15 years of weightlifting. I was clean and jerking over 400 pounds starting at the age of 17, did that for 7-8 years in a row. And then still kind of lifted heavy in my late 20s too. And my body just was pretty beat up. But in my mind, I was like, I won't need, hormone optimization therapy until I'm in my 40s. Because I think that was kind of the stigma where we thought, hey, it's only this is for old men, and I'm in my 30s. I'm not an old man yet. And, my wife, who was my girlfriend at the time, had encouraged me to say, hey, you're too tired to go on dates, amongst being too tired for other things. And she said, why don't you go get your blood work checked, see where you're at? And my total testosterone came back at 335 nanograms per deciliter. So I go, well, maybe I shouldn't wait until I'm 40, because I was concerned to the point where I'm like, if I feel this shitty at 32, hey, what's 42 going to be like? What's 50 going to be like? So I was pretty desperate too. And I've always worked 2 jobs and had some long hours, and I want to keep training and stay in shape. That's where my dad kind of prefaced it by saying a lifestyle where, hey, if people that want to be more active, this definitely helps with that. And when you do get optimized, you are able to do more. And I get that question too from a lot of kind of incoming patients. Say, what do you guys mean by lifestyle? And we say, well, on top of taking the medication, it does change your energy levels. You're able to do some things you weren't able to do. So you're able to kind of get more accomplished and enjoy life more. So I would say just kind of, directly affects your lifestyle. So that's what we kind of mean when we say that.
Yeah, absolutely. I think that's great. And you brought up some of the stigmas there, and I want to address some of those because you two are experts. You've been working in this field for so long, and a lot of the facts, and you've worked with so many patients, and you've probably heard all the myths and stigmas. So I want to talk about some of those head on. First of them being, you kind of brought this up, Jeff. What is the difference for folks who aren't familiar between TRT and like cycles or steroids? How do you draw the line there? And, let's just start there.
Yeah. I mean, I can take this one. So as far as, a cycle, typically when someone's running a cycle, they're running multiple compounds. They're running it where it's to become super physiological levels for a short term, where what we do is we're not necessarily looking to, put a level of testosterone back into your body, to optimize what you currently have, not a level that your body hasn't seen before. So it's when someone's running cycles, it's typically, the goal is to become, it's almost the super physiological level doses. And it's run, like you said, for a cycle is short term, where this is a lower dose. You may hear people in the bodybuilding world, they call it, hey, coasting, when they're kind of off, when there's not a competition coming up, they lower their dose. But we view this as, hey, you're getting at a coasting level where you're over the course of, indefinitely in some cases, where you're staying at a healthy range, you're having your blood work monitored, throughout the course of treatment. And I know sometimes when people hear cycle, there's usually when someone enters a cycle, it's not just testosterone, there's other compounds kind of stacked onto that at high doses.
Yeah. That's really helpful. And why do you think there's a general stigma against TRT itself as like cheating? Like I see people being quote unquote called out, older men who look great, who are healthy, and someone will say, "Oh yeah, but you're on TRT, aren't you?" Or they're even trying to like point out who's on TRT and who's not. Why do you think that exists?
Yeah, I mean, the number one thing for that, and I'll let my dad kind of think about, give my answer first, but it is that negative stigma from sport. Because if you look at what happened over the course of time with, whether it be in MLB or, Olympic sports or things like that, when they hear the word testosterone, they think, oh, cheater, that you're cheating what? Because I mean, you're just getting at an optimal level to help you live a better, healthier, happier life, essentially. So I think 100% of that, it comes from the sports world. It comes from the media. You see, Congress is in, you have Congress dealing with the MLB and interrogating people about it. So they think all these things are, they view anyone who does it, they're just flat out cheating, even though, I mean, I don't know if there's not a rule book as far as life or how you can live. But I mean, I think where do you kind of draw the line as far as what's cheating? I mean, someone that eats healthy, is that, eats healthier and gets some more energy from that. Well, is that cheating too?
Yeah.
Or someone that's taking vitamins. So, that's where it comes from. And this is the prime example that I always use. So if if I talk to one of my neighbors around here and I'd say, hey, if someone says, oh, my thyroid's messed up, I went to my GP, they gave me some thyroid medication. I'll say, oh, hey, that's, a wise decision to make, but it's beneficial for your health, right? It's another hormone where that by the general public is viewed at that is A-okay. But hey, if your testosterone is low and you want to optimize that, oh, hey, you're cheating, kind of like what you mentioned. So yeah, I mean, I think that the majority of the stigma, I think, comes from the sports world.
Yeah, I think that's right. And you mentioned getting a little bit older and starting to feel tired, not having as much energy for things. I want to ask a very general, basic question, and I'd love to hear your answer to this, Dr. Whitmer, how you advise patients. Who needs TRT and who doesn't, and how would a guy know?
I think almost everybody probably. At what point in their life is up for question. But,
yeah,
we used to, back in the day when guys would look at what we were doing and they go, well, you're taking steroids. And we would laugh and go, you know what? I took a vial of testosterone and I rolled it under the bar. The bar didn't move. Or say the same thing about a bottle of Dianabol or something. You still, and Jeff mentioned this, you still do the work. It's a lifestyle thing that consists of, protein in your diet, avoiding junk food, of course, training. I don't really care what kind of exercise guys do. I think as long as it doesn't hurt them, it's good. But you should do something. We're a very sedentary society, and I think that's part of the reason we're seeing so many people suffering from lower testosterone levels is because we sit around too much. And, somebody to blame. It's just the way our work culture has evolved. But I think there's also the evil testosterone. It's an anabolic steroid, and it gets lumped in with synthetic anabolic steroids, which do have some downsides to your health. It's a synthetic hormone. Testosterone was invented by God. So it's a natural hormone that we have naturally. We make it. All we're doing is giving guys more of what they're supposed to have anyway, versus taking synthetic substances, which do have downsides. Yeah, it can affect your liver, it affect your lipids. And they've done studies that have proven this. So what they've done is they've taken testosterone as an anabolic steroid. These anabolic steroids had some harmful effects. So therefore, testosterone is bad too. A lot of that is actually being disproven. There was a study just a couple of years ago I saw. They looked at low levels of testosterone and life expectancy, and the range they used was 440 and below. And guys that were 440 and below did not have the life expectancy of guys that were above 440. Now, of course, that's just an association. There's evidence that low testosterone causes them to die younger or not be as healthy. I think it could lead to health problems, but it's kind of like what comes first. Do you have low testosterone because you have another health problem that's affecting that? Or do you have low testosterone that's causing you to have a a fat belly and poor insulin sensitivity. And now you're having lipid disorders. So you wind up being on blood pressure medicine and statins and taking, if not insulin, maybe metformin. You're diabetic, or at least heading that way. So testosterone, you get your body to what you were at healthy 20-something levels when you were in your 20s. So you look at guys in their 20s, they can pretty much do whatever they want. Although you do see a lot more fat, out of shape guys in their 20s than I ever did back in my day. But, you could get away with doing things. You're not going to get fat as long as you're getting a reasonable amount of exercise. As we age and our bodies change, there you go. You start seeing the guys in their 40s and 50s where whatever's up here kind of shifts down. Whatever's down shifts up. It's all centrally located. The worst thing for your health, visceral fat. So that's, I don't know if I answered your question.
Yeah. Metabolism slowing down, definitely. What are some of the other symptoms of low T, or what would indicate that maybe someone should come in?
Here's the main thing that we see with the guys, and they're tired, they're gaining fat, they're losing strength, their libido is down. Some of them are coming in with, they have marital issues because of this. Wife thinks that there's a problem in the marriage. They've got a girlfriend or something like that. And I don't know, they're depressed. I'd be depressed too if that was me. And then they wind up going to their general practitioner who checks their labs, and they're within a normal range. We use Quest labs mostly, and the range for Quest is between 250 and 1100. So you could be 300 and you're normal, or 1,000 and you're normal. But I'm pretty sure the guy at 1,000 is going to be a little happier.
Yeah.
300. But they're told they're okay. Within range. It's lower, but it's within the normal range. It's normal. And then they offer them an antidepressant. See that all the time. And the antidepressant doesn't change anything except now they have brain chemicals screwed with their brain chemistry, and they think they're happy. Meanwhile, they're still fat. They're still out of shape, tired. Sex drive actually can get worse with some of those antidepressants. So wife's not happy, and she's probably letting him know that, but he doesn't care because he's got something up here screwed with his head.
Yeah.
He's happy. This is all good.
Yeah. And this is just to kind of add to this. I mean, I went through this around the time between 30 and 32. I go to my GP. My energy's low. And I'm not able to kind of work out regularly. I'm sleeping a lot, which is making me depressed. I go to my GP, kind of talks to me for 5 minutes. Hey, here's some, gives me 3-4 choices of SSRIs that I'm not very familiar with. And he goes, we'll just go with Paxil. It's been around longer. And I took that. It affected my balance. It affected my libido. You pretty much go numb down there. And you don't feel very good. You don't feel like yourself. You don't feel like you're in your own body. I had eventually I weaned off those once I was like, okay, I'm going to try something else. This is not the solution for me. It was making me extremely fatigued. I'd wake up in the morning, my eyes would be bloodshot. I felt horrible. I feel a little bit happier at some points throughout the day. Yeah, maybe a little more kind of outgoing. I felt like there was some benefits as far as that goes, but the other side effects that came with that, I was still depressed. And I'm messing with my serotonin levels to where I was able to go off those. And once I started the testosterone, so that's what, the mental health side, obviously the energy and gaining muscle is great. For me, what got me extremely passionate about this, and you can kind of tell, anytime you hear us talking about this, where the mental health benefits are huge, where it changed my life, where I don't have to take those SSRIs anymore. And I don't have to feel like crap or not feel like myself, where now when I take my testosterone's optimal, I feel like my old self mentally of how I felt when I was 20s. I have the motivation, I have the energy, then I can do the things I want to do. And then in turn on the effect of that is end up being happy. So, that's where I think we're trying to do our best to that's why we're talking to you here today, just kind of spread awareness about some of the other benefits. Because when people hear it, they just think a lot of time their head goes to muscle building and things like that. They're not aware of the mental health benefits of it as well.
Yeah, I certainly experienced that. I'll share a little bit about myself. I'm 28. I started TRT 4 years ago. My total T levels were 100 to 150 nanograms per deciliter. Like you said, at the time, normal was, I think, 300 or 350 to 1,000. They keep changing the reference ranges, but I had that checked several different clinics, several different doctors over the course of a year before I even considered starting. And I had a very flat mood. People would say, Scott, you're always so serious. You never smile. I didn't have a lot of enthusiasm to go out and do things. I lost kind of that fun aspect of being like silly and just really enjoying life with my wife, girlfriend at the time. And I had a really hard time putting on muscle as well, of course. And I exercised, I ate well. I thought I was doing everything right. Going on TRT has improved my life dramatically. Has made me much happier person, much more outgoing, more confident, not like aggressive or roid rage or anything like that, but just feel like more of a man in all the best ways. So it's been tremendous for me. And one thing I wanted to ask about is blood values versus clinical symptoms. How do you think about the difference between those and like deciding for a guy to start TRT? Does he need to have both low T symptoms and low blood values? What if he has one and not the other? How do you think about that?
Want me to take this, Jeff?
Yeah, you can take this one.
We focus more on the symptoms than numbers. I always go over these with patients and I tell them I'm almost talking out of both sides of my mouth because we sit here looking at their total testosterone, their free testosterone. We look at the ranges. Of course, we look at a lot of other hormones as well. But here we're looking at these numbers. And then on the other side of the fence, I'm saying, I don't give a damn about the numbers. You don't feel good. And this is what we can do to help you feel better. I tell almost everybody that they're not sick, that this is totally an option. It's an elective process here. This is why insurance doesn't cover it because they're within those numbers. I think with you, I would have told you you're sick, Scott. Those numbers were just horrendous.
Yeah.
That's not healthy.
Yeah.
Somebody your age. I've had guys in their 20s sit in the office with their extremely attractive girlfriends and tell me they have no sex drive. And the girlfriend just glares at me and I'm going, yeah, I know it's not you. But I don't think that's healthy in that instance. But, as you get older and you start slowing down, you can accept that. There's nothing wrong with that. I knew when I was in my 50s that I wasn't in my 20s. I didn't like it, but okay. It's such a gradual decline. It's not like falling off a cliff. So, I look around at other men my age and I think I'm doing all right. I'm looking at these guys and I could pretty much take him, I'm sure. But, as you start kind of sizing yourself up as you get older, How am I holding up? How am I doing? How are my bone spurs doing? But it got to a point where I just said, I don't have to put up with this continued decline. And my wife is definitely of the same mindset. And this is just something we decided to do almost as a couple. But you don't have to. There's no number you should do this, or you don't need it if you're over 600 or 700. We've given guys testosterone with some pretty high levels. And a lot of times there's things like sex hormone binding globulin tying up a lot of it. So their free T is low. But, the number is not going to be a major factor. We look at it more from a reference standpoint going forward. And want to rule out any major pathology, even underlying pathologies that might need to be corrected, or they might not need testosterone. So that's our approach. And I think it's pretty typical for most of the TRT practitioners that I hear from, is that we focus more on symptoms. It's really interesting. We give some patients thyroid. I don't want to sidetrack here, but I think this will help make my point.
Yeah.
Years ago, before the labs that we have now, the technology was available, when they treated low thyroid patients, they just gave them a small dose of thyroid, usually from ground up pig thyroid. And after a month, they asked the patient, how you feeling? Yeah, I'm not feeling any better. They give them a little more. And another month goes by, how you feeling? I'm not feeling any better. They give them a little more. Well, you know where this is going. At some point, the dose gets to where they're feeling good. That's their dose.
Yeah, just really smart.
I know guys now that TRT guys that do that with thyroid. They just start with a lower dose and work their way up. I'm not patient, so I'm going to try to get them there right away. But we have this discussion with the patients. If they're not patient and they want to go for it, then we do that and realize we may have to back it down. But that's what they did. So it was all based on symptoms. Well, now we've got these numbers, even for thyroid. And I've had people come in, the horrible hypothyroid symptoms, which a lot of those cross over with low testosterone, by the way. And we got to get their thyroid straightened out, even though they've been told their thyroid is okay. Well, once again, they're within the ranges. Yet they are incredibly tired. They could sleep 8 hours and they're still tired. They still want to sleep. They want to take a nap every day. Their eyebrows are thinning. Their hair is thinning. Their skin's dry, nails brittle, hypersensitivity to cold. They're always cold. They've got the little bit of that fat that they just can't lose, no matter, or even a lot of fat they can't lose, no matter what they do. I've had people with, I'm assuming they're telling me the truth with their diet and exercise regimen, yet they're still 30 pounds overweight. What's going on there? Well, get them on some thyroid, gone.
Yeah.
So that's, I think, to emphasize the symptoms over the numbers.
Yeah.
While we do use numbers, it's not the overriding factor in determining what to do going forward.
Yeah. Yeah. A big driver for me as well was I had extremely low bone density for my age, despite regular resistance training and eating a lot of protein. I was below osteoporosis levels of bone in my back and one of my hips.
You know why though, right?
The lack of testosterone. You need estrogen and you need testosterone.
There you go. Yeah. Lack of low estrogen because see, there again, you're sick.
Yeah.
So we could give you some bone density drugs. Yeah. Kind of, those aren't really the greatest thing in the world. Or fix your testosterone.
Yeah. Yeah.
Yeah.
And is there an age that you recommend men start looking into this, or is there an age in which you won't prescribe?
Well, we've had guys, I think the youngest was 21. And, there's some other hormonal issues there, a little more complicated. But, I don't know if you feel that you're not right, that you look around at your contemporaries and you just don't seem to be functioning at the same level that they are. You're not happy with whatever's going on with the decline as you get older. I don't think there's a right or wrong answer. I know I'm not helping you there where I say, well, if you're 40, you should have your testosterone checked. If you feel great and you're in shape and you're trim and you've got the muscle density you want and your sex drive is what you want it to be, which pretty much means as long as your wife's happy and you're happy, it's good, right? I'm not stepping in the middle of that. But it's a choice.
Absolutely.
We're optimizing your health this way.
Yeah. And can you talk about how people, when they do think that they may want to pursue TRT or hormonal optimization, whatever you want to call it, how can they look for a good doctor, and why might they want to go private versus trying to work through a GP or an endocrinologist?
None of this is taught at any medical schools or any healthcare institutions. It's totally outside the box healthcare. I don't fault anybody for what they do. I've got guys that I see that are getting once a month injections at their GP's office. And the Androgenic Society recommends 200 milligrams every 2 to 4 weeks. That's what they go by. There's been no formal training. That's okay. How do you pick a doctor? Well, if you go that route where they're probably going to bill your insurance and they can't prescribe to you unless you're outside of the ranges. So it's just, you're okay. That's what they're going to tell you. They may not even believe it, but they're going to tell you that. They're not going to tell you, I can't give you testosterone because you're at 260 and the bottom of the range is 250, so you don't qualify. They'll even some insurance carriers will require 2 blood draws before 9 a.m. because your testosterone is highest in the morning.
Wow.
Don't want to get it at the end of a rough day where you've been dealing with all kinds of stress. It's going to drop towards the end of the day like that. So they want 2 separate blood draws first thing in the morning. And if you're not below, then you're okay. Forget about what you're going through symptomatically. So they're not going to give it to you. Whereas I think a lot of I know I sit in these medical conferences with 100 doctors that are studying this from guys I consider to be experts. They would say they're not experts. But you learn how to manage this outside of the insurance game, so to speak. And the insurance companies fight this because they can't make any money off testosterone. Like I say, we were just copying what the body makes.
Yeah.
Make this. It's not a pharmaceutical, which they can get a patent on for 17 years and get all their R&D money back and pay whatever they have to pay to the FDA to get it approved. So there's no money in it. So every person that goes on testosterone that doesn't go on an antidepressant costs some money. I got a couple of cardiologists that have sent patients, and these were guys, they saw guys that what we were seeing that had lost 40, 50 pounds. They're off their blood pressure medicine. They're off diabetes medications. And even their statins, their cholesterol will improve. So they're off their lipids. And these guys are going, what's wrong with this? You've got a guy that was fat, was diabetic, with dyslipidemia, who goes on testosterone, and they see this drastic improvement. So it's healthy from that perspective. So it's really something that anybody that I think that's unhappy with their level of physical conditioning or fitness should consider.
Yeah, absolutely. I think those are a lot of great points. And I've tried to go back to GP to switch my medication over to get it covered under insurance. And it's an absolute nightmare. I've never been successful with that. But yeah, I'm content to pay out of pocket. I think it's actually, what's funny is even under insurance, because the compounding pharmacies through private clinics can get the drugs for so much cheaper, it actually nets out to about the same, trying to get it through insurance versus paying out of pocket. What are some things to be wary of? Let's say you do decide to go private and you look at some of these telemedicine or private hormonal clinics. There's a lot of bad practices out there. What are some things people should look out for, or some red flags?
I can agree with that one. I think there's multiple things, that you want to be aware of. One, the biggest red flag is when you see a place that's advertising, 3 prescriptions and everyone gets the same dose, where it's extremely cookie cutter. That's, like we said, we had talked about, really not, I would say it's very rarely where we have 2 people that are on the same dose of all the same prescriptions. I mean, it's variable, where they have it set up that way just because it's the easiest way to do it. There's not much follow-up care. They throw everyone on an estrogen blocker, testosterone, and sometimes even HCG. It's just, they usually package it in 3 scripts. They say, here's a membership fee. Plus on top of that, you pay for your prescriptions. Another red flag is the initial blood work. They want to run with some of the telemedicine companies and other clinics. They want to run the most minimal amount panel possible. Well, I see them all the time. We have people transfer from clinics because they kind of, it's a lot of times it's a bait and switch in some of these places with price. There's hitting cost on there, but they'll run a panel of big red flag is if they'll run a, total testosterone and 3 or 4 other numbers, and that's it. So we'll say, this place is going to get me started on these 4 numbers. When we look at over between 60 and 70 different markers on our blood tests, we're looking at overall health and all the hormones like thyroid, like we mentioned, where I refer to those places as kind of just testosterone mills, where they do it the cheapest way possible for them up front. And they charge membership, and then they charge you kind of per month. And it's just extremely cookie cutter. Another huge red flag, and this is what really bothers me, is I see, obviously I do a ton of research on this stuff. So and I'm sure you do too, Scott. And when you get on your Instagram or Facebook, you get hit with all the ads, you get kind of targeted some of these places. I said, okay, I'm kind of curious about this place. I'll go to their site. I can't find who their doctors are. I can't find who their staff are. I can't see their qualifications. Who's prescribing? And then I can't even find a video anywhere of the doctors, going on a podcast or posting a video or talking about it. I mean, I don't know about you, but I was like, I don't really, I guess really the patients that just pick their doctor based off a Facebook ad isn't necessarily the ones we want regardless. But I think, sometimes, hey, if someone's feeling bad and they get kind of tricked into the price and they think of that way, where that to me, that's concerning, where I'm like, you can't even tell me who your staff is or who's going to be prescribing and their qualifications. Seems extremely sketchy to me. I see that with even a lot of local places in our area, along with the national, the telemed type companies. And I think that's what bothers me. I said, I can't see who the doctor is, because usually, probably guys like us, any doctor that I've seen in my life, usually it's a family or friend referred me, or I've done extensive research about them. I'm not just jumping the gun because I see a price out of pocket and a sexy looking ad or whatnot. So yeah, that is a huge one to me, and that one kind of drives me crazy. Like, hey, you say you're the best, if they say, hey, we're the best hormone clinic there is, but we're not. Well, who's your doctor? And they don't tell you. So I think that's kind of interesting.
Absolutely. I'd agree with all that. And one thing you both mentioned, Jeff and Mike, is the long-term testosterone being a lifestyle and some of the long-term health impacts. Why is testosterone for life? And should men be thinking about it that way when they decide to go on?
I think as long as they want to feel well, they should think about it that way. You can always stop, and then your levels are going to go down. They may even be lower than what they were before you started. Everybody recovers differently. And, we see some younger guys that are taking testosterone for the rest of their life because they used extensive anabolic steroid cycles in their very young years, in their late teens. I don't know for sure, but in thinking this through, I think the younger they started this in their teens, they never let their own natural endocrine system gain a foothold in their body. They shut it down before it ever started. And therefore, now they're in their mid-20s, and it's just not going to happen for them. I've seen a few guys that took anabolic steroids for 5 to 6 years without going off, starting in their late teens, 18, 19 years old.
Wow.
Now they're 26, 27 with testosterone levels next to nothing, some even fertility issues. And now this is it. This is where it's at. You can live like you're living or take testosterone. And again, it's a choice. You don't have to. But we have a number of guys that were competitive bodybuilders, some of them at a pretty high level. I'm a little envious of them. They're in their maybe mid-50s. So they did their thing in their 20s and competed and ran their cycles, maybe went into the early 30s. And when they stopped competing, they stopped using anabolic steroid cycles and just stayed on low-dose testosterone. So they've been on TRT forever.
Yeah.
They of course, they're OCD about their training and their diets. The bodybuilder guys are very disciplined when it comes to this. So these guys are in their mid-50s, and they look phenomenal. And they're just taking a regular dose of testosterone. If a guy looks at them and thinks they're cheating, well, they're cheating life. They're cheating years. They're cheating death, I guess.
Yeah.
Because they're in just tremendous shape, very healthy guys. And kind of looking back, I know when I started when I was 59, my wife and I both said, God, I wish we'd have done this 10 years earlier. I bet if I had started when I was 49, I would have gone, God, I wish I had done this 10 years earlier.
Yeah.
I kind of wish I would have done it like Jeff is actually in my mid-30s, and just kept that level of fitness my whole life. Because I've seen these guys that have done it, and they're in tremendous shape. They're very healthy guys. So yeah, it's you can look at it like that. Once you go on, you have to stay on testosterone. You don't have to. As long as you want to feel good, you probably do.
Yeah.
So it's a choice.
Yeah. And what are possible long-term negative health impacts of being on TRT, and what bloods do you monitor?
We, in that regard, we keep an eye on lipids. Lipids will usually improve, especially if estrogen goes up some. That's very cardioprotective. That's really it. We check the PSA regularly on guys. There was a thought over the years that prostate cancer was caused by higher testosterone or testosterone-fueled prostate cancer. That's still out there. We've had a few patients that over the years, they developed prostate cancer. There's still a lot of different attitudes among the urologists. I've had a couple of guys, their urologist told them they should stay on testosterone. And others, they said, you have to stop because it fuels prostate cancer. You're one of the doctors you know of, Abraham Morgan Taylor, has discounted that with an extensive amount of research. So if you look at the guys that develop prostate cancer, well, they're old men, and what old men have low testosterone, and you don't see young guys with high testosterone getting prostate cancer.
Yeah.
So it's kind of backwards thinking, but I can't really think of a negative effect over the years. There's no bad side effect. It's a natural hormone that we make. And we're just keeping guys from deteriorating to near death with very, very poor hormone levels.
Yeah.
We keep them, like I said, at healthy 20-something level.
And here's the way I kind of explain it too, where like we talked about earlier, where when you hear about some of those side effects that come with the territory, it is high level doses for a long period of time. These are lower level doses. But if you think of it this way, I mean, if you get into say you have suboptimal testosterone and other hormone levels, but you keep those at optimal levels, what does that do when you get into your 60s and 70s? You're able to be more active, which we know, I think that's been confirmed. It's beneficial for your health. You're able to exercise more regularly. So you're in a lot of cases, and I think it can increase life expectancy because your hormones are optimal level and you're able to keep moving, keep exercising versus, hey, if what we see a lot of times too, where someone has followed their diet closely, they've worked out, and they, have gotten older to where, hey, that they're doing everything right. And then their just testosterone levels are tanked. And then all of a sudden they can't work out as much. They still try to eat healthy and it's hard to keep up with it. But then once they get, their hormone levels optimal, then they can get moving again. And, I think that's a way, that's the way I view it and see it, just from getting feedback from patients and how they look and feel. Our older patients in their 60s and 70s, like, hey, I can exercise and move again. And then that, versus being sedentary, up to their older ages.
Scott, I need to kind of hitchhike a little bit on that. When you asked me that question, thinking of older guys, long-term TRT utilization. So side effects for the younger guys, fertility is a concern. And we discussed that initially. We've had some guys decide they just don't want to start it until they're finished having children.
Yeah.
The guys, we just add HCG to what they're using when they're ready to conceive. And that works very well. HCG mimics follicle stimulating hormone and luteinizing hormone, which stimulate the testicles to make testosterone and sperm. Those are shut down when you go on testosterone, because the hypothalamus in your brain is going to see that you have plenty of testosterone. So it will not make gonadotropin releasing hormone, which stimulates the pituitary to make FSH and LH. And you kind of mentioned a red flag. If you're on testosterone and they're still looking at FSH and LH, that's going to be zero.
Right? It should be. It should be a non-concern.
Yeah. Unless there's we don't look at it after they start. We look at it before they do. But okay, so you start, you're on testosterone, your testicles will stop producing testosterone and sperm because you don't have to, you don't need it, you're injecting it. So your fertility goes down. You're not sterile. We always tell them it's not birth control. we've had patients with wives that got pregnant while they were on TRT. Even girlfriends got pregnant. TRT. But back in the old days, we used to have a saying for guys that thought they could use anabolic steroids or testosterone for birth control. And, we called them dad. So
Jack Dad.
Fertility is something to think about. Your testicles might atrophy. Not everybody reports this, but just like if you don't use muscles, they're going to get softer and smaller. If that's a problem, it's purely cosmetic. But we can use HCG because that'll plump them right back up again. So that's purely cosmetic reason for HCG versus the actual functional reason where you want to have a higher sperm count. That's Jeff mentioned, or you mentioned red flags. Jeff mentioned some of the cookie cutter approaches. I've had guys come in their 60s with vasectomies that were taking HCG because it was part of the program and they needed to keep their testicles functioning. And I said, okay, planning on having any more children? And I already read their charts. So I know they've had a vasectomy, and they look at me like I've got two heads. I go, no, I had a vasectomy. So I know that. I saw it, but are you going to get it reversed? And I'm 61. No. But, well, then why are you taking HCG? Because they said it was part of the program. Yeah, okay, well, you're wasting your money.
I think with HCG too is one of them where, you're probably, I know you follow the diet stuff close, Scott, where you probably have heard of the HCG diet.
Yep.
Where, it's eat at the caloric deficit, take some HCG, you're going to lose some weight, but are you losing weight because of the HCG, or are you losing weight because you're eating 500 calories a day? And so I think that for the most part got debunked. And I know, people will argue and say, hey, there's all these other benefits to the HCG, but, there's some research out there showing it could have an effect on receptors and help cleaning cleaning receptors. And there's some out there, and I don't want it to come up whenever I get too deep. I don't want it to come off as bro science. But yeah, I think there's a lot of overselling going on with the benefits of HCG, that if you're taking an optimal dose of exogenous testosterone, I go on and off HCG, because I want to have more kids. And, when I'm on it, do I feel any better or different, or all of a sudden I'm super lean and I can see my lower abs all of a sudden? It doesn't have that effect on me. And I haven't really heard of anyone. So that's just my kind of take and opinion on it. Because I know there's always a lot of argument to say, if we say, hey, it's primarily for fertility and testicular atrophy, people say, well, there's all these other benefits. If your testosterone's optimal, I don't feel benefit myself. And from a lot of other people I talk to don't. And Dad, I don't know if you have kind of anything to add on that, but from things I read, I know people say, hey, there's all these other benefits. And I think a lot of those have been debunked.
Yeah, we have some guys that like HCG. They like the way they feel with it. And they stay on it. They might go off here and there, but they stay on it quite a bit. That's just what they feel. They like it. I think one of the reasons we dropped their testosterone when they had HCG, because the HCG is going to get some natural testosterone generated, then they don't need to inject as much. But that's a balancing act where they had that HCG with a little lower testosterone, and now they have more testosterone working for them than what they normally do. So they feel that effect. Some of the guys really feel that it leans them out. We're in June, and a lot of the guys like to use HCG during the summer because they feel it leans them out. I don't argue with them. That's a little bit of a theory behind why it might help lean them out, is because their testosterone goes a little higher than usual. Maybe they are now training at a little higher intensity. They're probably also watching what they eat a little more in the summer because they're out in the pool or a beach or something like that. But I think, again, we don't recommend it unless you want to conceive or you're just conscious or self-conscious with the testicular atrophy. Somebody take it because their wives want them to take HCG. That's their preference. Okay. Yeah. But let's just be upfront about it so you understand why you're doing it, rather than just everybody takes it for this reason when you don't really need it for that reason.
Yeah, I took HCG alongside testosterone for my first 2 years of treatment, low dose. I I used so little. I was able to get top of the reference range in the trough, which means basically you take your blood. For people listening, you take your bloods as far away from your testosterone injection in the week as possible to see how low your levels get. And I was up at 1,000, 1,100 on 120 mgs a week. So I'm a high responder, and I was using that alongside, I think 250 I use of HCG a week. So really, really low dose, or maybe it was 250 twice a week. I did that for the first 2 years, but I eventually dropped it because I had no reason to continue being on it. I think I had just fallen into like following certain forums or certain groups of individuals who really thought it was necessary to feel better. But I haven't noticed a substantial difference other than cost less to be on one drug than two. Yeah. But one thing I wanted to ask with regards to the fertility and TRT, so completely understand that fertility can go down or be shut off on TRT, not necessarily, but it can, and there are ways to jumpstart it with HCG. How about sperm quality? Like, let's say I am able to conceive when I want to have kids. Would my sperm quality be lower, and would that affect like the quality of children I can have if I am on TRT versus not? No, but I will tell you, I don't think it's funny, but I'll tell you a story. This one of our regular patients, this guy's in his early 30s, and he and his wife were ready to start a family. She actually got pregnant while he was just on testosterone, and she miscarried. But that was okay. They weren't planning on it anyway, so they waited, I guess, probably the end or about a year later, and he calls up and decides they're ready to go. So, okay. So we dropped his testosterone dose a little bit, threw in the HCG on top of that, and she got pregnant 4 times and miscarried every one of them. Oh. So the gynecologist couldn't figure out what was going on. So you know what the gynecologist told her? She miscarried because her husband was on testosterone. Oh. So the doctor couldn't figure out what was going on, but his wife wanted him to stop testosterone. So he called me up and we're talking, you're fertile. She got pregnant. It's not you. She's got something going on there with her hormones, but she can't maintain a pregnancy. And he told me the doctor did start her on progesterone. And I said, well, if that doesn't work, you're looking at a fertility clinic, obviously. But to tell the woman that they blame the husband being on testosterone for her miscarriage, because, I don't know what she believed, but she wanted her husband to stop testosterone because of that. And he did. He's back on it now, and she's pregnant now. But and she maintained the pregnancy, obviously, at least so far. But I don't know where some of this stuff comes from. Yeah, I actually froze my sperm before starting testosterone. You're a special case. Yeah, seriously. Yeah, I know. Yeah. I started probably way earlier than most men do, and had way worse symptoms than most men do. Actually, funny enough, I never had the erectile dysfunction, even with really low testosterone. Like, it was never at all a problem with me. I've always had very healthy libido. But yeah, the other symptoms were quite bad. That's interesting you say that, because that underscores the maybe insignificance of the numbers. Yeah. Yeah. How come I can see a guy with a poor libido with 550 total testosterone, and then they will say severely depressed, get them up to 1,000 and it's great. Yeah. And you're at 150 and you're fine. Yeah. It's strange.
I think, just to add to that too, is where we'll have guys that will come to us and they'll think it's just an erectile dysfunction issue. We'll run their numbers, testosterone will be low, because they really come in with the intentions thinking they're needing ED medication only. We see their testosterone's low, they get to an optimal level, and they're like, oh man, like I don't need Cialis or Viagra or any of this, or Blue Chews or whatever is out there. Now where it kind of fixes that issue. Now, that isn't always the case. Sometimes there's another underlying issue. It could be tied to circulation or amongst other things, but I always just thought that was interesting. A lot of times that can fix the issue there. Yeah. And
You talk about key cutter approaches. So one thing I think we have to talk about is estrogen and AIs. So starting at the top, what is estrogen? Why is it important? And why are guys afraid of it?
Well, estrogen is a female hormone, or at least it's predominant in females. Men need estrogen. We make a little bit of it, certainly compared to women. So it's associated with women. And the benefits of estrogen, as I mentioned earlier, it's very cardioprotective. Here's a good example. If you hear of a 45-year-old dropping dead, is it a guy or a girl?
Always a guy.
Yeah, almost. I don't know. It's in the 90 percentile range. It's very heavy guys. Women do not have heart disease like men. That is until they get into their late 50s, early 60s. And then they start catching up to us. Well, what's happened to a 60-year-old woman? She lost her estrogen 10 years ago. So now she's starting to have cardiovascular disease. The aromatase inhibitors were invented to treat women with breast cancer. Those are medications that block the aromatase enzyme, which converts testosterone to estrogen. So with women that have breast cancer, they want them to have zero estrogen if they have the hormone receptor site positive breast cancers. And it's really hard on them because you take a 38 or 42-year-old woman, she doesn't go through perimenopause and missing a cycle here or there with a gradual decline of her hormone. She goes off the cliff. She's bottomed out immediately. They feel miserable. Their bodies change. They get fat around the waistline. They're tired. They don't feel good. Their libido drops. Their skin gets dry. It's really hard for them when they go through that. But it works. They do not die of breast cancer. Oh, wait, they don't live longer. They die from heart disease. Yeah, I read the damn studies. It's very interesting, and it's even something that's debated. Pick your poison. Do you want to have a better quality of life and eventually the breast cancer catches up with you, or you want to feel like crap for 10 or 12 years and die of heart disease? It's really difficult to look at it like that, and hopefully nobody ever has to, but you do. So estrogen is very cardioprotective. Now, the bodybuilders really, estrogen's their mortal enemy. Because with estrogen, you get fluid retention, and they want to be shredded and ripped. Even some of our guys, I discourage an estradiol unless you have to have it. And some guys actually do need it. I don't think very many do, but I'll never say always or never.
Yeah,
I just said I'd never say never. But these are guys that have a little different goals, and we talk about the pros and cons. And they want that appearance. Now they'll complain that their joints are creaky and stiff, especially guys in their 40s and 50s. I used an estradiol for a while because several years ago, that was just part of most protocols. There's been more information coming out now, more research. Neil Rouzier is where I get a lot of my information from attending his conferences. But estrogen is good for our joints. It's good for our bones. It's good for our libido. It's good for our lipids. And it's very cardioprotective. So
it can help you build muscle too, right? And it can help you recover from exercise, and it can help you build.
So the fear of it, I think, is the association with it being a female hormone. Yet, we have estrogen and we need estrogen, just like women have testosterone, they need testosterone. You want to talk about our ranges for the total testosterone for women, the range is 2 to 45. So you could have 3 or 43 and you're normal. That's a huge range. For the testosterone, it's even worse. It's 0.1 to 6.4. So you could have
it's criminal.
Almost zero testosterone, and they need testosterone. It's healthy for them. A lot of the women we see, they want to be muscular, they want to be lean, they work out hard, and they want to have a normal libido. So testosterone works wonders for them too. But I don't know. I think you'd have to ask people why they're afraid of estrogen. I think there's an association with emotion, being overly emotional, the roid rage. I kind of see it in the opposite, that low testosterone guys are probably angrier than guys that have testosterone. I'd be angry.
Yeah.
I'd be very unhappy.
I was.
Yes. And if that's what you're experiencing, then it's real. But I know guys that, they were pretty much jerks off steroids, and they were bigger jerks on steroids, but they thought they could use that as an excuse to be a jerk. And I know guys, they were the nicest, calmest guys off drugs. They were the same way when they were on. But we all can respond differently. And I've had a few guys, they just tell me they don't feel right. They're crying at dog food commercials. Or, I mean, seriously, a guy told me that he's crying at a dog food commercial. Or they just get overly emotional for no particular reason, and they could tell, I don't feel like myself. So that higher estrogen is having that kind of effect on them. And we look at it symptoms-based versus numbers. So we will use pretty low dose of anastrozole. And I'm going to say, oh gosh, if it was 5%, I'd be sure. I'd be surprised if it was that many.
Yeah. I don't know if you touched on this not or yet, Ted, but I think one of the fears when people say they're going on testosterone and they're not taking a estrogen blocker, that I think one of the fears is the gynecomastia, where people will think automatically, hey, I don't take the aromatase inhibitor, I'm going to get gyno, like for sure. So I don't know if you wanted to address that as well.
Yeah. Can you just describe what gyno is for people listening who might not know?
Well, when you have gynecomastia, you have the dense fibrous tissue underneath the nipple. There's a genetic predisposition to that, and increasing estrogen could set that off or at least exacerbate it. Most of the guys experience tender or puffy nipples, which is mastalgia. It's not gyno. Usually that subsides as your body adjusts to the newer hormone levels, just like the fluid retention that they notice initially. A lot of guys will notice that. And after a time, when their body adapts to the testosterone being higher and estrogen being higher, that'll subside.
Yep.
I think back in the day, it seemed to be much more heavily an issue in the bodybuilding community than with powerlifters and weightlifters. And knowing some of those guys pretty well, they did much higher doses than we did. We thought we were doing a lot, but man, they were off the charts. And even now, it's even worse. Some of these pro bodybuilders spend like $70,000 to $80,000 a year on their programs or drug programs.
Wow.
So I don't know if that would have been a factor in why it seemed like more of those guys had trouble with this. But and I know a few weightlifters that had to have the surgery to remove the tissue, but many, many more bodybuilders that had trouble with that. I don't think it's a huge issue with testosterone optimization because we're not going there.
Yeah.
You're not injecting a gram of test a week or two or more. So I don't think it's quite the same comparison.
Yeah, I agree. And one thought on a potential utility of AIs, I think, is just having them on hand in case something goes wrong. Like, for instance, I when I started testosterone replacement therapy, probably because I was still producing some naturally, or just the way I was injecting or administering or something, in the first 2 weeks, I gained, just as you spoke about, Dr. Wittmer, with the adjustment period and your body adjusting to new levels, I gained like 20 pounds of water in 2 weeks when starting testosterone. My face blew up. I looked like a balloon. It was actually one of my best friend's weddings. And there are pictures. I don't even look like the same person. And that went away very quickly without AIs. But that might be an instance potentially where you just take a small dose of an AI for a couple days in a very smart titrated dose, and it just kind of corrects the problem.
We do have a few guys that use it on an as-needed basis. They don't take it often. They might take it once a month or twice a month. They just have a time where they can tell these are your veterans. Whereas this isn't their first run. They've been doing this for a long time, and mostly underground or black market sourcing. but they just know their bodies very well, and they'll take a low dose. I don't think we refill their prescriptions maybe every 2 years because they don't go through it very fast. But I think that's fine. That's an option.
Yeah. And the other thing I've heard talked about, and I think is actually pretty smart, is actually trying to stop taking estrogen labs when you're on testosterone longer, and just managing it by the symptoms. Trying to basically let your estrogen get as high as you can tolerate for the cardiovascular benefits.
Yeah, I know my lipids improved 20 to 25% when I stopped an anastrozole. That was several years ago, but I did do it for a couple of years. Kept it at the sweet spot that they all talk about. So we let testosterone go up to the high end of the range, but we want to keep estrogen at the middle of the range. Well, why not put testosterone in the middle of the range then? It's a thought process, but it doesn't make sense. But yeah, I eventually just, I'm going to see what happens. And I felt better. My joints felt better. Of course, the lipid was nice. Zero side effects from it. I have guys with extremely high estrogen levels that feel great.
Yeah, I've seen mine get up to 80, and I feel fine. I have no negative side effects. So
yeah,
I'm happy with that. I want to talk a little bit about administration, injections versus cream versus pellets. A lot of guys have fear of needles when they start. How do you help them get over that? And maybe what are some of the benefits of doing injections versus other administration techniques?
Well, the gels are the prescription products, Testogel, Androgel. Those are alcohol-based, and you've got to put a lot on, cover a lot of area of your body. Transfer's an issue, and absorption's an issue. I've read studies where they say anywhere from 30 to 40% of those are absorbed. The creams are a little better, about 70%. That's not an alcohol base, it's Versa base. Those are applied on the scrotum. And they'll say roughly 70% of that gets absorbed. The creams have to be applied daily, just like the gels. Guys that like that steady level, some are very sensitive to fluctuations, which you're going to get with injections. So they like the creams for that reason. Very few of our guys use creams. And the reason they do is because they just don't want to take injections. They just don't want needles. So that's fine. But the injections, 100% of it gets in your system.
Yeah.
There. The downside of that is you're going to spike your level in about 24 to 48 hours. Then, depending on the particular ester, but let's just say roughly in a week, you're down to 1 half-life. So you're down. Then you take another shot. So you build that up over 5 to 6 weeks where you're going to have your spike and then it's going to drop. And you're in that range. And if they're uncomfortable with that, we just split up the dosing. Or some guys go 3 times or every other day dosing. So they don't go as high and they don't go as low. They feel good all the time. Very much optional. I'm very flexible. If this is what they feel good with, then it's fine with me. And as I mentioned earlier, we can respond differently, so I don't get in the middle of that. The pellets are more expensive. And we do see people that have had pellets. The issue with pellets is, number one, the cost, but they're in there for 4 to 6 months and you don't have to do anything. So that's a nice benefit. I've never seen anybody that was on pellets that had their blood monitored. So they don't know what they were. That's just me. That's just what I've seen. So it's not like I've seen 1,000 guys that were on pellets, but quite a few, and women. I think women more so than men use the pellets, but you can't adjust the dose. Once it's in, it's in. I suppose you could get them removed, but that would be a little bit like a hunting expedition, cutting in there looking for a little, rice-sized pellet to take out.
Over the last few weeks, I've talked to quite a few people that went through the pellet injections and just heard some bad stories as far as trying, I did hear some places running blood work after, and then their symptoms not improving. And so they were, injecting more pellets in. And then I've heard times of, hey, the doses got too high, and then they're going and taking it, where it's think it's close to having it surgically removed. So, I have not talked to very many, and I talk to, hundreds of people a month about this. And, I have not talked to anyone yet that has had a very good experience with the pellets. I think the mentality of a lot of the places that do it, it's kind of like my dad said, it's a set it and forget it. Hey, it's in there. Then, then you go get more in later. It's at 4 to 6 months, and there isn't a ton of monitoring going on. It's just sold, hey, it's a little easier. You can charge more up front as well. The people that we've had that were on pellets that came to us and did the injectables, they said, why the hell was I ever doing the fucking pellets? I was stupid. And so, and not to say that maybe there are some people that have had some benefits from it. I think they're few and far between, at least from my experience being involved with this. And we do get a lot of patients that, decide it's not the right thing for them, but maybe it does help for some people. I think I've heard some things a little bit as far as how if some of them can release at different rates. And if it's at too steady of a rate, your body can get a little more used to it. And you don't feel the effects as well. And I don't know. I think that there could be some truth to that, but we definitely, anyone that has gone from pellets and gone to injectables, everyone that we've dealt with reports that they're feeling much better.
Yeah. If we have somebody in the office that's been on pellets, well, why are they in our office? If they were thrilled to death.
If it was going so well.
Yeah, they wouldn't be looking around. Now, having said that, there's plenty of people out there doing just great on pellets. Or they're happy. Maybe they'd be happier with another approach. But, some of the, I go to these regular conferences, so you kind of get to know some of the doctors, and there's some that are exclusive pellets. And I know there was a woman that they said does more pellet injections than anybody in the United States has ever done.
Wow.
Yeah, it's her thing. And that's what they do. And she's extremely successful.
Yeah, she's making a lot of money.
Well, yeah, but there must be satisfied patients that are happy with what she's doing.
Well,
she's doing well.
I know who you're talking about, and they offer a lot of other services too, where they, as far as med spa type stuff, they keep people coming to the door. But I'll say this: I mean, there's a local place here. I think they're marketing pellets to males that are, and they're going to plug them in they partner with one of the gym chains here. And when I hear that, it's, for me, I'm just like, well, that means we're going to have a lot of patients here really soon after, these people are coming into these pellet places. It's not working. They're going to start, looking for some other options because they're going to start doing some research saying, hey, why am I not feeling good off the pellets? So when I heard that, I'm like, well, looks like we're going to be having a lot more patients here coming pretty soon.
Yeah. It's like a physical therapist when a new CrossFit gym opens up. They're like, oh, great.
Go right next door. Yeah.
It keeps But they're in a lot of the same buildings actually now.
Yeah, makes sense. Go right from one to the other. One topic I wanted to ask you both about is hair loss. And, a lot of people say hair loss is genetic. There's nothing you can do. You're going to lose it either way. There's something called androgenic alopecia, which, has to do with the androgenic side of testosterone. Testosterone, for folks who don't know, 5-alpha reduces in your body to dihydrotestosterone. It's a derivative of testosterone. And specifically in your scalp, that's what causes your hair to fall out and also causes hair to grow in other parts of your body, chest, back. Do you have a lot of men who suffer from hair loss? Do you think testosterone, TRT, exacerbates it? And is there anything you do to try to help them slow it down?
Well, just like with everything, with some, it's an issue. Most, it's not. Obviously, there's a genetic predisposition to that. I know back in our days, some of the guys, when they started using anabolic steroids, they noticed their hair went. Now, most know. It didn't affect me. Now I don't have as much hair as I used to, but I'm 67, and it's family. It's in my family. It's genetics. We're all bald. But I guess I've never been one to be really concerned with my hair. So maybe I don't look for that problem with the guys, and the guys are more interested in something else. I do have a few guys that have used, Finasteride, those drugs, which block the conversion to DHT, but it also has really trashed their hormones. And, it's actually very sad. They've got a nice head of hair and they can get a woman, but they can't do anything with her, versus a guy that might be bald, but he can do it. And women will actually like some guys that are bald. So
yeah,
I feel sorry for them. They got so into their hair, and actually some of them, they refuse to stop those medications even because they're worried about their hair. And sometimes testosterone just won't overcome it, even increasing their testosterone.
Yeah,
taking those drugs, and it's just a choice. And they chose to maintain their hair, and even though they're fat and out of shape, and I don't know. It's not a huge thing on my radar, and I just don't hear guys talk about it in the office. I know I read about it and the theories, and I guess I'm not helping you there.
I haven't, I haven't had anyone come back to me that has said, hey, I'm going to stop because my hair is starting to fall out or anything like that. I haven't. I think you read stuff and people will say, hey, their hair will start to fall or thin, but a lot of times it could be taking a lot of other things too with that as well. I think a lot of it goes to the genetic predisposition that, hey, if it's, could it potentially slightly speed it up if you have that genetic predisposition because of DHT? I think potentially that's the case, but if you look at yourself, you've been doing it for a little while. You look pretty thick up there. You're taking some finasteride or something. But
I'm happy to talk a bit about my own experience. So it's extremely genetically predisposed in my family. My dad and my grandfather both lost, and on both sides of my family, lost like all their hair in their 30s. So my hairline has started to recede, and I've had some thinning up here on the crown. But I want to have some hair loss experts on, hair loss doctors on as well. Just an episode on that. So I've actually started using dutasteride, which is a stronger version of finasteride, but I use a topical solution. So a lot of the side effects you're talking about with finasteride, alopecia, it's because when you take it orally, it goes systemic. So you need DHT for a lot of other functions in your body, sexual function, libido, a lot of other things. And when you take finasteride orally, it just blocks DHT everywhere. It just nukes it. That's not great. You really want to just block it here. So I use topical dutasteride. I rub it in my hair. It's stronger than finasteride, but it doesn't go systemic. So it's too early to tell if it's working, but that's something I'm using.
So
great.
Far.
Yeah. Well, this has been fantastic. Really appreciate both of you coming on. I think this is a fantastic introduction, as well as, going deep on certain topics for folks who are more familiar with TRT and hormone optimization. So I want to thank you both for that.
Yeah, our pleasure.
And where can folks find out more about you, follow you and your content, or learn more?
Yeah. So I'm on Instagram. So just my name's just at Jeff Wittmer. So then our clinic's Instagram handles National Rejuvenation Centers. And then our website, nrcenters.com is where they can find us. And then we obviously treat patients in person. And then also we cover about 30 we have licensed physicians who cover about 30 prescribing physicians, but all the initial consults, my dad runs, almost 30 states via telemedicine as well, with the hopes of getting close to 50 by end of 2022.
Fantastic. Well, I'll have links to all of that in the show notes for folks to check out. And thanks again so much for your time today.
You're welcome, Scott.
Thanks, Scott.
Thanks for listening to this episode of the Making a Man podcast. If you enjoyed it, please review on Apple Podcasts. It helps other people find us, and share it with a friend. What questions or topics would you like covered, or who would you like to hear from on the show? You can find me on Instagram, Facebook, and Twitter at Making a Man Pod or Making a Man, or go to makingaman.co. You can also email me at scott@makingaman.co. I'd love to hear from you. Until next time, Danger Zone!